Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Joshua Reischer. He's co-founder and CEO at HealthNote. Welcome, Josh.
Thanks so much for having me, John.
Yeah, excited to do another in our series of interviews with Ambient Clinical Voice, AI Medical Scribe, AI Assistant companies. We'll see how that branding that category develops and is called. But before we dive into your product and your solution, tell us a little bit about yourself and HealthNote.
Sure. So I'm Josh. I'm one of the co-founders and CEO here at HealthNote. My background's in internal medicine, was a practicing physician up until about 6 years ago now. Loved seeing patients, did not love collecting, organizing, and documenting data, which is what I spent most of my day doing, and really wanted a better way to have all the information I needed for that to go where it belongs in the chart. And that's really where we started with HealthNote. So we did not start off with scribing. That being said, we've been writing millions of notes a year for years now, but doing it from a very different perspective. The way we do it is by conversing with patients before they show up for a visit, asking them all the questions that a provider would normally ask before a visit. So not just a standard intake that someone would give you at a doctor's office, but that plus the questions that a doctor would truly ask you. And whatever specialty you would go to, we would ask the questions several days before a visit, send patients a text message, contains a link to our platform. Then we take all their answers and formulate that into documentation that goes into the doctor's note. So we've been doing that for about 6 years now. We work with clinics and systems around the country. So while scribing is new to us, writing clinical notes and notes for physicians is definitely not new.
Interesting. So before you started doing the scribing, like how much of the note could you collect from the patient before? Give us a feel for like, is that the majority of the note? The doctor had to add it? Like what was the previous workflow and what was the story of kind of adding in ambient scribing as well?
It's a great question. So in some specialties, we might write 90% of a note. So let's say sleep medicine, for example. For some visit types, a new patient coming in for sleep issues, we might write 90% of the note, everything except the assessment and plan, because we're asking when a patient wakes up and when they go to sleep and a whole bunch of other, I'll call it straightforward questions that might be asked for a straightforward reason for a visit. For other reasons for a visit, we might write less of the note. And every specialty will be a little bit different. But in pediatrics, for example, for a well child visit, we might ask a majority or nearly all of the questions and document all of that before the patient even shows up. And we would ask everything from basic demographics to medications, allergies, social history, family history, and then specifically the HPI, right, which ends up being the meat of the note. So the history of present illness, the reason that the patient's actually coming in. And of course, things like the review of systems, kind of like head to toe type questions, seeing if there's any other ancillary things that are going on with the patient. One thing we definitely would not do beforehand that is more possible to do during a visit is things like the physical exam or the assessment and plan. We are not and we're not doing that in a pre-visit standpoint.
Interesting. So, I mean, then you have this evolution to add in, the ambient clinical voice. Obviously, I'm sure you saw the explosion of it. How does your solution now compare to the, wide variety of ambient clinical voice companies out there? I'd list them off, but it's better to go to healthcareittoday.com, click on ambient clinical voice, you'll find them all. But, how does it compare now? I mean, obviously, you're doing a lot of pre-charting, if you will, from the patient encounter. Is that the big change? And then after that, is it about the same? Or talk to us about how it compares to other solutions.
So that's a major difference. There's lots of great products out there. I've used a number of them. It's becoming harder and harder to tell the difference between them. The quality is so much better over the last 6 months. And while lots of people talk about different models that they have beneath, I've not seen a major change, and I've spoken to dozens of physicians now who honestly find it very difficult to tell. And especially if you have functionality to change templates and have other customizations, which our platform does, you really enable physicians to get what they want. So then it becomes which platforms, tools, et cetera, have an easier way to make it more customizable for you that works in the way that you need it. So once you have a way to take essentially the transcript, right, and then summarize that in a way that's useful for you, that ends up being the most powerful platform. And so from day one, we started making our platform something so easy a 70 or 80-year-old patient could use. And that's how we thought of things, is like make something that's really, really easy to engage with. What we realized once we started working with ambient scribing is we had to make something so easy a clinician would use it. And I say that not necessarily jokingly. What I mean by that really is that it's not that the physicians or other clinicians don't have the capacity to learn something, it's that they are so busy, they don't have the time to learn something new. So while, yes, a 70 or 80-year-old who's not familiar with technology might have some difficulty using new tech, physicians, while they may have the ability to, they don't want to. So if you don't make something so easy for them to use, they will not use it. That's what we learned. Everything from signing up to pressing record, the more you automate and the more you're integrated with the workflow, and the easier it is to use, the more likely physicians will use it, and not just use it, but get value out of it and continue to use the platform. So that's how we've thought about it. Now, some of the unique value components that we bring is that because we are asking all these pre-visit questions or have the capabilities to do that, when folks are using both parts of our product, both the intake and the scribing piece, we just recently launched the ability to combine those components together, meaning that we can take the pre-visit information and put that in a summary where the physician can look at that in the scribing platform as well. So actually combining those two pieces together.
Interesting. Well, and I imagine you'd want both of them together because that should inform the note that, what the patient offers and vice versa. What does the workflow look like for a clinician, and maybe talk about a little bit of the onboarding? I think it's a little different than maybe some of the other AI assistants out there, which is just like hit record and it will do it for you. That's what they espouse. Obviously, we know there's some nuance there, but talk about your onboarding and what the workflow looks like. And it sounds like for you, we need to start from the patient intake. Talk to us about that full workflow.
Yeah, I'll explain the two different workflows. I'll explain pre-visit with scribing, and then there are many clinicians using our product as a standalone from a scribing perspective. So I'll explain both. Okay. When we're talking about intake, there's a longer process because we are integrating very deeply into the entire EHR, and it becomes a whole clinic workflow. And so that's a more involved implementation, to put it simply. From a physician standpoint, the data comes in before the patient even shows up for the visit and then goes into the note at the time of check-in. So from a physician standpoint, it's interesting that while scribing can sometimes be amazing and better than the pre-visit information, what we've heard from our folks who are using our platform, it's often more valuable to have the information beforehand, and that's where you're getting the time saving, by having all that information up front. I'll give you just a concrete example. One of our neurology customers, a neurologist, told me that he would have an hour visit for a new patient coming in for headaches to get the full history. But now he can do that with the same quality in 30 minutes because he has all that information ahead of time. And he told us, honestly, he's like, scribing is interesting, but it's not that helpful for me because I can type just as fast and it helps me process as I'm doing that. Once he started using the scribing product, it was interesting because he said, well, actually, it's really valuable for these more complex patients where we may not have gone into all the nuanced questions when it gets really a little bit out there or esoteric. So he finds value for different patients at different times using the pre-visit documentation versus scribing. And you'll hear this across the board. It doesn't matter which scribing product you'll talk about. When you actually ask physicians, do they use it for every visit? It depends on their specialty, depends on the reason for visit. Some are using it all the time, some are using it 50% of the time. So combining these two really brings more value more of the time. So that's a high-level answer. In terms of onboarding from a scribing perspective, we really optimize for how do you have as few clicks as possible. We were literally measuring down to the click and how long it takes. I was involved in watching physicians and other clinicians in person and on Zoom. Like We literally got on a Zoom call and watched them do this of like, what does it take to click sign up from our website to getting value, meaning pressing record. And so it is extremely easy to start using the product. You do not need to train it by any means. We'll ask you for your specialty, and there'll be some different templates for different specialties, but it's really, really simple for physicians and clinicians to start using the product. Now, if they want to customize their note, that's also pretty simple. And so, yeah, I mean, it's under 3 minutes for sure. We'll ask them to read something to actually, it's not to train anything. It's actually to make sure that their microphone is working and that they get used to things, but it's not actually to train the models.
Interesting. And is this on desktop, mobile app? You know, what do you see as kind of the form factor that people are using your products?
For new folks, we find almost all of them are finding us on mobile. So then they start to use it on mobile. But what we see is after Note 2 and 3, they're much more likely to use it on their desktop or laptops, but they can use it either way. We have, it's available on mobile, and a mobile app is coming in the next couple of months.
Awesome. And, you know, this question's starting to get a little dated, but, you know, talk to us about how much of this is automated with technology versus humans. And, you know, obviously there's a human on the front end, the doctor, we all know that. But how do you, you know, how are you approaching kind of automating it fully with technology or versus, you know, involving humans on the back end as well?
Yeah, it's 100% automated. There's no human in the loop here. We've gotten amazing feedback. Just right before this call, I got off a phone call with a PA in Lexington, Kentucky, who works in the ER and was telling me how his life has now changed because he gets to go home to his 4 kids because of what we've done. He just reached out to us completely unsolicited and said, how can I share this with other people? Sent me his resume and said, can we just chat? So I just spoke with him for 15 minutes, literally right before this call. No human in the loop. He was telling me about how having ICD-10 codes, having additional assessment and plan ideas in front of him has helped him come up with things and said, oh, maybe I didn't think about that beforehand. So absolutely no human in the loop, and we're getting amazing feedback.
That's awesome. And let's talk about EHR integration. I think that, you know, to your point, I actually agree with you. I saw that early on that from an accuracy standpoint, everyone's going to have a note that is relatively accurate. At least we can't distinguish the differences. But EHR integration is going to be an interesting one, you know, as people approach it different ways. How are you integrating with the EHR? Does it work with all the EHRs? Talk about that.
Yeah, that's a great question. So our intake product is very deeply integrated into the EHR down to every single field. I'm talking about demographics, review of systems. We literally click buttons and drop downs right into doctor's notes. So extremely deep. I'd probably say the most well integrated pre-visit platform on the market that asks questions on behalf of a provider. I've personally not seen anything more integrated. There could be one out there. I just haven't seen it. But that being said, that product's only available on 3 EHRs right now. So that's on Epic, Athena, and Allscripts, now known as Veradigm. So those 3 EHRs are where we started with this really deep integration. With the scribing product, we are working on integrations for those 3 EHRs and any web-based EHR on top of that as well to make the integration points, I'll just call it a lot simpler and easier. So we'll have 2 different integrations. One, I'll just call it like a really fast integration, and then a deeper integration for those who need or want that.
Interesting. And let's talk about the clinicians. You know, what do they have to change as they're talking in the exam room using your solution? You know, how does their workflow, you know, what do they need to learn? What's the onboarding process? You talked a little bit about the sign up process, which I think is cool. You know, and maybe it's from 2 perspectives. One, if they have your front end, you know, patient intake process, how does that change how they work in the exam room? And then any other things you train people on? The obvious ones we've heard over the years is you have to say something that you're thinking or seeing. You can't just, you know, like ambient voice can't read your mind or see your, you know, vision yet. Maybe one day. Anyway, I'd love to hear, you know, kind of the clinicians. How do you onboard them? How do you train them? Any other things you're seeing as far as making the most of your solution?
So if we split this up by the personas of folks who have either not used ambient scribing at all, or are they currently using a dictation product, whether that's something where they're talking into a microphone or they're used to calling a service, or have never done anything at all, right? And so what we've seen is, depending on their experience, they need different levels of onboarding, training, or help. If they've used another scribe, zero help. They get it, they understand, there's really nothing new to learn there. If they're used to dictation, lots of them are comparing it to dictation. And what we found is, especially specialty groups who have used scribing products, focus products, not ambient listening. They're often used to shortcuts or dot phrases where they're saying something out loud and they want to know, how does that work with an ambient listening? And so actually we just launched a feature that enables folks to say something out loud. So for example, if I was seeing you, John, in the office and I said, okay, it looks like your physical exam is normal, except that I'm seeing some swelling in your lower left ankle, right? Something like that. We can automate that where it literally shows up a normal physical exam that you chose and then just changes the part about your ankle or foot or whatever that's maybe not normal, so that they can say that during. Now, some people say, hey, I don't want to say something like that during the exam, and they can dictate that afterwards. So we hear different workflows for different folks, and we try to accommodate those different workflows. So that's generally how we think about it. And someone who's never used anything at all, I think it's an iterative process. What we see is it typically takes 6 to 8 notes for a provider to feel really comfortable with something and then essentially be sticky. Like, to get to the 6 to 8 notes might take them a few days. Some get there right away on day one, but some take a little bit of time. Once they're at 8 notes, they become a daily user. They sometimes drop off at 2 or 3 notes because they had some questions, or they might say, hey, the note didn't look the way I expected. Even though we might have a button that's relatively clear, they didn't notice it and say like, oh, I can configure it to my needs. They may not have noticed that that was there. They were busy. Once we show them like, oh, actually, we can configure this pretty simply by making this bullet pointed or paragraph style or what have you, then they're like, oh, okay, got it. And then it becomes more valuable to them immediately. So the onboarding is more of an awareness. So we're trying to build that more into the product so you can't miss it, where it's obvious without being too walkthrough, right? It's always a balance of
you don't want to treat them like petulant children that don't know anything, but you want to make sure they see it.
It's a fine balance depending on the experience of the provider.
Yeah, absolutely. Let's talk about accuracy. I always find this fascinating to see how people approach accuracy. You know, how do you look at how accurate your solution is as far as notes? Obviously, there's an overtone of hallucinations in here as well, but how do you evaluate how accurate the note creation is in your product?
Yeah, so a couple of things. One thing that's probably fairly obvious, but the microphone and the method in which someone is recording the conversation is probably the most important thing. At least in our product, I think in many products, right? So are they using their phone? Are they using their computer? How far away is it, right? Because how noisy is it? This person I just spoke to who was working in the ER, I was literally just asking him about that. He said he's using his phone. That's working really well. But I think that's one really big component is like, where are you placing the microphone? Because it starts with that. Now, what's interesting is with AI, the large language models, it can take a transcript that's not perfect and make it a whole lot better, right? It can clean it up to a degree, but that's where there's potential for hallucinations is when the transcript itself, right? The original document is not perfect. Then you're taking something that's not perfect and then summarizing it or making assumptions based on that. But generally, I think what's interesting with ambient scribing and the reason the uptick has been so large is because whether the accuracy is 95% or 99%, it's the first time where AI is being used. It's so highly trusted, but the stop point is the physician should and basically has to sign a note where it's not automatically going into the chart. That's what's amazing. Now, in terms of accuracy, what accuracy can be, is there hallucinations, or is there more information than I want from the provider standpoint? So we enable providers to customize. Do they want more details, less details? What things do they want? So for example, we noticed with behavioral health, on our first early testings, some of the large language models were taking out certain items from the documentation, self-harm, things like that, because they were trained to not work on those types of issues. So they would actually take that out of a long transcript, which is very different than maybe a typical provider visit. So we had to work around some of those complexities or issues. So generally, we're seeing amazing accuracy, and a lot of that is related to being able to configure what the note looks like, especially per specialty.
Yeah. And it's interesting. I think you kind of mentioned that even after the visit, they can go in and do some voice dictation to add to the note as well. Talk about that. I think that's becoming an interesting part of this, I think, for a lot of the vendors. Is it all in the visit? Can you do it after? And I think different doctors have different views. They do want to wait till after to say certain things, although patients love hearing the detail, I think. So yeah, talk about that.
Yeah, there's certain components of a visit that providers do not want a summarization. So for example, when we work with orthopedic groups and they're looking at an x-ray, they want to report what they're seeing, and they're used to dictating it. They don't want a summarization of their dictation. They want straight dictation. So there's dozens of reasons where you do not want anything summarized. You specifically want what you're saying in real time to go there. So that's one of the many reasons why dictation is important.
Awesome. And how about specialties? How does your product work across specialties? Are you focused on specific ones, or you work with all specialties? How are you approaching that?
Yeah. So in our intake product, we work across all specialties, although we do have a larger number of primary care, pediatrics, women's health, and then orthopedics and urology. So I'd say that's sort of a lot of our customers, because they happen to have been a lot of our intake customers. But from a scribing perspective, we're hearing everything in between. Like, we don't typically work in the emergency rooms, and this person I just spoke to was working in the ER. And we're generally hearing and seeing similar needs across, with some specific variabilities. Like dictation seems to be more important for the procedure-based or procedure-focused specialties, or where it's more common. So a lot of the surgical subspecialties that can happen, you can do or have procedures in primary care, but it's less frequent than in orthopedics, urology, or interventional cardiology, right? So they'll have differences. And then in the use cases like behavioral health, that's actually quite different, right? Because you're often having longer conversations where you're often talking about things that you may or may not want to summarize. So there's some very specific outliers, but most actually come towards the mean, is what we've seen in having similar needs. We've actually interviewed different specialists and say, like, would you need a different product? Like, what is missing from what we're doing? And very rarely are we hearing, no, I need a product specific for me. Now, the caveat there is they want specific features and functions, but the features and functions between specialties are not that different. That's what we're seeing.
Interesting. Yeah, I heard recently that, like you compare the mental health note, it may want to know the chit chat of I was visiting family and I have friends, and that may be an important part of the note. Whereas that chit chat with, your ortho, you probably don't want in the note. So it's like, it's interesting how nuanced it is across specialties. So
we solve that with different templates and setups for those different specialties.
Yeah, absolutely. Well, I think, the number one question everyone that watches these videos is, where can they learn more? Where can they get a demo? So where can people learn more about HealthNote?
So it's pretty simple, healthnote.com. You can reach out to us, but you can also go up and sign up for free. We've got trials where people can, within a few clicks, start using the product themselves. And within the product, we also have the ability to converse with our team. So if you have any questions or need help onboarding, actually our team, the real people, are looking at the messages and can help you get set up if you do have any questions. And that's all in real time.
Awesome. Well, Josh, I appreciate you taking time to talk about your solution, and excited to see how it evolves over time, especially the integration of the pre-charting with the ambient. That's a pretty unique feature I haven't seen. So thanks so much for taking time to talk with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Josh.
Thanks so much, Jonathan.